A common question I always get when it comes to hand issues is what's better, heat or ice when it comes to hands? Well, let me share with you my perspective on when it's better to use heat and when it's better to use ice. And you can use both, like which one helps you the best, right? My name is Huang. I'm an occupational therapist and certified hand therapist here at Hands On Therapy Services in Miami. And I get this question so much when it comes to like hand pain. And specifically, I was talking about trigger thumb. So if you have a trigger thumb issue, you can check out a couple of the other videos that I've made about trigger thumb and what to do and how to treat it. But I've had some recent cases of people coming in with thumb pain, hand pain. Sometimes it is a trigger finger or a trigger thumb, and they're just like, what do I do if I'm trying to help myself, right? The research shows out there, like especially when it's a chronic issue, you can use ice or heat or whatever. Here's what I find to be the best. If you have a joint issue, like how do you know if you have a joint issue? The joint is the bones, right? The bones have to move well together. And the bones move well together when the ligaments that hold it, ligaments only hold bone and bone together. And we have ligaments on each side of all of our joints that hold our bones together. And when the ligaments get tight, then the joint gets really stiff and it doesn't feel like it moves very well, right? And when you try to press on it, you can see that it doesn't really move that well, right? And then you compare how you move to your other hand, right? So in your thumb, you can compare, look at how freaky my thumbs are, that they go way, way back. And they can also come down. I always measure based on this line. This is my crease where my fingers bend, and I can take my thumb all the way across to below this crease. That's how I know my thumbs work really well and that I can move without pain. So if I'm moving my joints and my joints feel really stiff and I don't have enough movement, I like to use heat. And there's a difference between the heat. There's moist heat and there's dry heat. Dry heat is like you taking like a heating pad and the heat goes on, it's dry heat. You sometimes you'll buy those little mesh bags that have rice inside or whatever. You throw it in the microwave and you heat it up and then you put it on. That's dry heat versus moist heat. Moist heat is something like paraffin. Paraffin is hot wax that you can dip your hand inside and then take it out. Delicious. It's so good. I love paraffin for when you'll have really stiff joints, like arthritis or after, like we treat a lot of people with surgeries. We treat a lot of people with fractures, with arthritis. Did I say arthritis already? So those can be really great. Paraffin can feel really good. Anytime I work with anyone with thumb issues, like a trigger thumb or any kind of thumb issues, I love using paraffin because it wraps around all the thumb really, really well. But that's considered more heat. Hot water, like a hot water bath, can be really good for joints. And I like heat for joint stiffness. It is not a long lasting treatment, right? So that's the thing. When you have the heat on, it feels yummy, it feels delicious. And when you take it off and you cool down, the treatment or the effectiveness of the heat kind of goes away. So it's a very short lived treatment. So you can totally use it. It feels really great when you're doing it. We use it in therapy when we have someone who's really stiff and we want to make a certain amount of progress in therapy. So we might start someone with heat. But it's not something I recommend people like constantly do all day because truth be told, is a little time consuming, right? But heat works really well. If you have the time to do it and you have the need for it, then by all means, use heat. It's really wonderful. Ice. I personally love ice, especially for chronic issues. I don't necessarily use ice when it's like right away and acute. It just depends on the scenario and what's going on. But if you've had pain for a while, ice can be really good and really soothing, and ice actually has a longer lasting effect. There's been research that says you can use both, right? But the research behind the ice says that, you can go a certain amount of depth in under, into the tissue that then will reduce the inflammation for a short period of time, right? So one of the reasons why I like using ice on certain parts of the hand is because our hand's really thin. It's not the same as like your hip or your back. You have big tissues there, but in your hand, for example, if you're doing it for a trigger thumb, Your tendon is really right here, and it's so on the surface. If you have a trigger finger, then your tendon is also on the surface. Wherever your crease is, that is where your pulley is, and that the pulley system is just like a ligament that that holds that tendon down so that your fingers can move better, right? So when you have pain, it might be right around here, and I love using ice to help to reduce the inflammation. Now, does heat and ice cure everything? It doesn't. It gives you temporary relief. The best treatment for any kind of trigger thumb, trigger finger treatment is to figure out where it's coming from, why it's happening, and then move your tissue accordingly so that it could start to move better. If you have joint stiffness, so I just was working with someone who had trigger thumb, and she was treating it on her own for months, I think. And she was wearing the splint that just kind of stopped it from moving. She was getting some other treatment right into the joint as well, but it wasn't going away. She was using heat, she was using ice intermittently, but it wasn't going away fully. And the reason why it wasn't going away fully is because in her self treatment, she started to lose motion. So, you know, our thumbs, you have to look at your own thumb. I have freakish thumbs, so don't compare your motion to my motion. Compare your motion to your other motion. And if you don't have it, then you've lost motion, right? So this was her. This is her thumb, and then on this side, it was down like this. So she kept having pain because she lost motion. And then her tendon was, I always describe it as an alignment issue, right? If you're driving in your car over a period of time, your balance will fall out of alignment, right? Sometimes you might hit a curb or two and then your alignment goes off. Well, don't you have to tune that up? Don't you have to fix that so your alignment works? And then when you're going straight, you're actually going straight instead of veering to the left or veering to the right. That's the same with your tendon. So if you fall or you had something happen and you're a little bit out of alignment, so your tendon could be like veering a little bit more to the left. Most of the time it's moving, it's like not where it's supposed to be. And this tendon is very important. It's actually supposed to be centered right between, because we have these little itty bitty balls, they're called sesamoid. They're like little bones that holds their tendon on track. And what I've noticed is people who have trigger thumb, their tendon is like off track. It goes with the hand too. And so ice and heat can help resolve some of the pain that you have temporarily. So you can treat it. I love using ice for it, but ice massage. So instead of just massaging it and then putting ice on it, you can freeze a bottle of water. Like I love a round bottle of water, right? Drink the water first, refill it with tap water, whatever, freeze it standing up. And then when you take it out, you can essentially roll your thumb on that frozen water bottle, and you don't even have to do it for that long. But I love teaching my patients to do it. And if you have a trigger thumb or a trigger finger and you're wondering, well, does heat or ice work? They both can work. It's just when you're going to use it, how you're going to use it, and together with what other treatments will you use heat and ice to get the most effective relief from trigger finger and trigger thumb, so you can avoid injections and surgery. All right, so keep that in mind. There's help available to you if you have a trigger thumb, if you have a trigger finger, and actually the sooner you get to it, the easier it is to treat, right? Once it becomes a big freaking ball in there and it feels like you have this big old knot, it makes it really hard to treat. Now, some people have trigger thumb and trigger finger and they don't have any pain. Their finger just gets really stuck. Well, at some point, it's going to be so stuck that you have to have surgery to get rid of it. For some people, they don't even feel the triggering, but they have so much hand pain that they can't do anything, right? And so you never want to wait until it's so bad, because help is available and is actually available to you really soon, really fast, so it doesn't get worse. So I hope this video helps you to get some idea of what you can do, but also when it's a really good idea to get some help. My name is Huang. I'm an occupational therapist and certified hand therapist here at Hands On Therapy Services in Miami. So if you're in the Miami area and you have hand pain, thumb pain, give us a call. Let me know so we can help you.